A 64-year-old man with type 2 diabetes presents with fever, flank pain, and dysuria. CT shows emphysematous pyelonephritis. Which is the most appropriate immediate management? A. For antibiotics alone. B. Oral ciprofloxacin at home. C. For antibiotics plus percutaneous drainage. D. Emergent nephrectomy in all cases. Answer: C. Emphysematous pyelonephritis is a necrotizing infection common in diabetics. For antibiotics plus percutaneous drainage is first line, nephrectomy is reserved for severe, refractory cases. A 52-year-old woman with rheumatoid arthritis on methotrexate presents with progressive shortness of breath. HRCT shows ground glass opacities. What is the likely cause? A. Methotrexate-induced lung toxicity. B. Interstitial pneumonia due to RA itself. C. Pulmonary embolism. D. COPD exacerbation. Answer: A. Methotrexate pulmonary toxicity presents with subacute dyspnea, cough, fever, and diffuse infiltrates. Stopping methotrexate is crucial. A 40-year-old man presents with hemoptysis and renal impairment. Serology shows positive CANCA. What is the most appropriate initial treatment? A. High-dose corticosteroids plus cyclophosphamide. B. Hydroxychloroquine. C. Low-dose aspirin only. D. Beta blockers. Answer: A. Granulomatosis with polyangiitis requires urgent immunosuppression with corticosteroids and cyclophosphamide/rituximab. A 69-year-old woman with chronic atrial fibrillation is admitted after a fall. CT brain shows a lobar intracranial hemorrhage. She was on warfarin with 3.5 Indian rupees. Next best step? A. Give vitamin K only. B. Stop warfarin and observe. C. Administer prothrombin complex concentrate plus vitamin K. D. Start DOAC immediately. Answer: C. Life-threatening warfarin-associated bleeding requires urgent reversal with PCC and vitamin K. A 58-year-old alcoholic presents with weakness, confusion, and ataxia. Which vitamin deficiency is most likely? A. Vitamin B1, thiamine. B. Vitamin B6. C. Vitamin B12. D. Folate. Answer: A. Wernicke encephalopathy is caused by thiamine deficiency, classically seen in alcoholics. A 71-year-old male smoker presents with hyponatremia, now 118 millimoles per liter. Serum osmolality is low, urine osmolality is high. Which malignancy is most likely? A. Small cell lung cancer. B. Renal cell carcinoma. C. Colorectal cancer. D. Melanoma. Answer: A. SIAD is strongly associated with small cell carcinoma of the lung. A 36-year-old man presents with migratory polyarthritis, fever, and new systolic murmur. Which test is most specific for confirming the diagnosis? A. Anti-streptolysin O titer. B. Blood cultures. C. Echocardiography. D. Rheumatoid factor. Answer: A. The anti-streptolysin O titer confirms recent streptococcal infection, which is essential for diagnosing rheumatic fever. A 50-year-old woman has recurrent nephrolithiasis. Analysis shows calcium oxalate stones. Which preventive measure is most effective? A. Restrict calcium intake. B. Increase fluid intake and dietary citrate. C. High protein diet. D. Low fluid diet with vitamin C. Answer: B. High fluid and citrate intake reduce calcium oxalate stone formation. Calcium restriction worsens risk. A 45-year-old man presents with cirrhosis and massive ascites unresponsive to diuretics. Which is the next best intervention? A. Daily albumin infusions. B. TIPS, transjugular intrahepatic portosystemic shunt. C. Hemodialysis. D. For fluids and rest. Answer B. Refractory ascites and cirrhosis is best managed with TIPS to reduce portal hypertension. A 55-year-old woman with lupus presents with new chest pain, pericardial rub, and diffuse ST elevation. What is the diagnosis? A. Pericarditis. B. STEMI. C. PE. D. Angina. Answer A. Pericarditis shows pleuritic pain, pericardial rub, and diffuse ST elevations, common in SLE. A 70-year-old man presents with microcytic anemia and weight loss. Colonoscopy is normal. Next best step? A. Capsule endoscopy. B. Start iron supplements only. C. CT chest. D. Bone marrow biopsy. Answer A. Iron deficiency anemia with negative colonoscopy requires small bowel evaluation, usually capsule endoscopy. A 62-year-old man with COPD develops acute dyspnea. ABG, pH 7.30, PaCO2 70 mm of mercury, PaO2 55 mm of mercury. What is the most appropriate management? A. High-flow oxygen at 100%. B. Non-invasive ventilation, BiPAP. C. Oral steroids only. D. Intubate immediately without trial of BiPAP. Answer B. Acute hypercapnic respiratory failure and COPD should be managed with non-invasive ventilation first. A 48-year-old woman has fatigue, skin hyperpigmentation, hyponatremia, and hyperkalemia. Which hormone is deficient? A. Cortisol. B. Insulin. C. Thyroxine. D. ADH. Answer A. Addison's disease presents with cortisol deficiency, causing electrolyte abnormalities and pigmentation. A 37-year-old man with HIV presents with cough and fever. Chest CT shows cavitary lesion in upper lobe. Which organism is most likely? A. Mycobacterium tuberculosis. B. Pneumocystis jirovecii. C. Aspergillus fumigatus. D. Histoplasma capsulatum. Answer A. Cavitary upper lobe disease in HIV strongly suggests TB. A 60-year-old woman with long-standing hypertension presents with muscle weakness. Labs, K plus 2.9, metabolic alkalosis, suppressed renin, high aldosterone. Likely diagnosis? A. Primary hyperaldosteronism. B. Cushing syndrome. C. Renal artery stenosis. D. Addison's disease. Answer A. Primary hyperaldosteronism presents with hypokalemia, hypertension, suppressed renin, and high aldosterone. A 43-year-old woman has diplopia and worsening weakness later in the day. Tensilin test is positive. Next step in management? A. Start pyridostigmine. B. Start levodopa. C. Begin corticosteroids only. D. Order EEG. Answer A. Myasthenia gravis is best managed initially with acetylcholinesterase inhibitors like pyridostigmine. A 67-year-old man with chronic kidney disease develops bone pain and elevated PTH. Which is the mechanism? A. Secondary hyperparathyroidism. B. Vitamin D intoxication. C. Osteogenesis imperfecta. D. Malignancy hypercalcemia. Answer A. CKD causes phosphate retention and low vitamin D, leading to secondary hyperparathyroidism and renal osteodystrophy. A 39-year-old woman presents with heat intolerance, tremor, and weight loss. TSH is suppressed, T3/T4 elevated. Radioiodine scan shows diffuse uptake. Diagnosis? A. Graves' disease. B. Toxic multinodular goiter. C. Thyroiditis. D. Factitious thyrotoxicosis. Answer A. Diffuse increased uptake is diagnostic of Graves' disease. A 75-year-old man with dementia develops acute fever and cough. Chest X-ray shows right lower lobe infiltrate. Which organism is most likely? A. Klebsiella pneumoniae. B. Streptococcus pneumoniae. C. Pseudomonas aeruginosa. D. Anaerobic bacteria. Answer D. Aspiration pneumonia in elderly dementia patients is most often caused by anaerobes. A 50-year-old man with poorly controlled diabetes presents with black necrotic nasal tissue and orbital swelling. Which organism is most likely? A. Mucor species. B. Candida albicans. C. Cryptococcus neoformans. D. Aspergillus niger. Answer A. Rhinocerebral mucormycosis is common in diabetic ketoacidosis and causes black necrosis.